join in.
And if there's anything that you would like us to look at and give advice on, then you can send a picture to our DM, and that's something that we can have a look at.
Definitely.
Okay, we're there.
We're there?
We are there.
Great, fantastic. Well, welcome to our first ever live. We are new to this, so please be patient to us.
Please be kind.
Please be kind. So my name is Dhalia Masud. I am one of the plastic surgeons here in Norwich. And
I'm Rachel.
I'm Hayley.
Yay, so welcome. We are a very close-knit team. Please feel free to ask as many questions as you need. I want to say thank you to everybody who's already asked us questions in advance, and we will try and go through them slowly throughout the next half an hour or so. But just want to introduce the clinic. We are based in Norfolk, in a lovely picturesque clinic called Brook, or area called Brook. It's very private, so if you are a very private person, it's a great place to come and have your procedures. We've had loads of compliments with our place, haven't we? So that's fantastic. Now, we offer lots of things in our clinic. Obviously, we do consultations for patients that want to have any form of surgery. That includes facelifts, neck lifts, abdominoplasties, any kind of body contouring. And importantly, there are lots of patients that have non-cosmetic stuff like cancer surgery. So we do local anesthetic procedures such as skin cancers. And if you need big reconstruction, microsurgical reconstruction, we see you here, and then we'll do you over at the Norfolk and Norwich Hospital, and we see the follow-up here. So what kind of things do we offer here at the clinic? So there's lots of non-surgical. We're going to start off with the non-surgical stuff. There's lots of non-surgical stuff, and Rachel
Hayley.
and Hayley.
Right.
It's because you're on that
I'm on the other side on that screen.
So Hayley does lots of non-surgical stuff. So you're an expert
Yes.
in radiofrequency.
Yes.
Now, I usually ask patients, so the radiofrequency is generally for people who have a little bit of laxity around the neck, around the face. They're not quite ready for facelifts, but they want something subtle that works a little bit more effective than the stuff that you use at home, or they want to get themselves ready for a facelift.
Yeah.
Okay. So tell me about your experience. Just be honest. I want you to be honest. Tell me about your experience with radiofrequency and facelift patients, or pre-facelift, or patients that just want that little give or tightness in the neck and the face.
I think personally, after doing it for quite a while now, you do get more of a snatched look, which is, some people are quite happy with it in regards to that they don't want to have a facelift or anything done just yet. It's not a miracle straight away, but I usually say you have 6 sessions to begin with. And after, I would say, around the 3rd session, you start noticing it more in yourself. And we've had really, really good results, haven't we?
Yes.
And repeat clients who, after the 6 sessions, they want to continue with it. But I think it works really well, like you say, on the neck, kind of giving you more of a chiseled jawline.
So I tell you I advise this. You're the one that actually physically does do it.
Yes.
Does it hurt?
No, it doesn't hurt at all. It's actually, the feedback is that it's quite a nice treatment. So when they come here and go in your room is completely different to mine. Mine's nicer in regards that there's no cutting happening in there. But yeah, it's a really nice heat, and we work with your skin. So there's different levels of heat. Some people can tolerate a stronger heat to begin with, but we generally start off low and work up high. Yeah, it's great.
Yeah. And do they get any redness?
You can get some redness. There's always risk to everything, but generally with the procedure, or I call it procedure, you can walk out and and look exactly the same pretty much as you came in. So no one's gonna, if you're doing it on your lunch hour, no one is gonna ask you any questions. It's not gonna be overly noticeable.
You might just get a slight tingling feeling.
Yeah.
Don't you sometimes?
You can do, you can get some tingling, but generally it's more a sensation, isn't it, that you get? There is a little bit of suction that we add to it, and then afterwards we finish with a red light for 10 minutes, which really helps.
So I think radio frequency is fantastic for kind of those that want to go halfway between doing something at home, thinking about surgery, or want to prepare themselves for surgery. I think it's important that people use it with some products. Crucial 3 things. I would always recommend everyone use 3 things. Okay, number 1, retinol, some degree of retinol. Some people may be sensitive to it, so you might have to play around with what product is useful for you. There are products for all kinds of sensitivities when it comes to retinol. The other thing I would recommend is a vitamin C, and that's an antioxidant, and that helps with repair. And then SPF. Now there are so many products out there, and there are so many companies, and we've worked quite closely with Tropic, along with other products. There are lots of products, but we're going to specific because Rachel is an ambassador for Tropics. So tell me what your experience is with the Tropic. Why do you like Tropics?
Well, we were very excited, actually, weren't we, to get on board with Tropic. So, am I not in there? As a company, ethically, they're carbon neutral, and they do, it's all the recycling, it's the giving back to charity. But from your perspective, it's having the active ingredients that obviously you need, because it's all lovely having these really beautiful quality plant-based ingredients, but you want to know that actually your skin is going to get the actives. And that's what made us so happy, wasn't it, to have the product. So
it's one of the very few companies that I feel are transparent with the ingredients. It just says on the package retinol, vitamin C, whereas a lot of the other products I find you buy and I'm like, I don't really know what's in it. It smells nice.
Exactly.
Great.
And we'd spoken before, hadn't we, about using these scanning apps to look at products and what awful things can be in a lot of them. So we're really proud to be advocates for this, aren't we, in the clinic? And one of the exciting things this year was the exosome cream that came out. So exosomes, you can probably explain this more, but it's very small molecules, isn't it, that goes into the protein cells for renewal.
Exactly.
Yeah.
You can do more than I can.
So this is perfect for any facial rejuvenation, but for patients that have had surgery, facial surgery, eye surgery, this is going to be the go-to,
that's
isn't
the
it?
latest go-to
The
Rolls Royce of, particularly under the eyes. Everyone who we have found, we won't use anything unless it works. I don't use anything unless it works. And we found the exosomes are really effective. We found the radio frequency effective. And I think it's really useful for that craggy skin underneath the eyes. If you're tired, you've woken up and you're very dehydrated, obviously drink lots of water, but this gives it that extra boost and extra tightening effect that I found, and I've used it on myself.
The feedback has just been incredible, actually, from patients, hasn't it? Using, all the products are good, but if you didn't want a full skin regime, then actually your focus particularly is the serums with the really powerful actives, isn't it? So it doesn't have to be complicated. It can be whatever you've got the time for in your life. But yes, they're really, really powerful.
So we like the radio frequency. We've tried loads of machines, but we like the radio frequency.
I love it.
We've tried loads of products. I'm telling you, we have tried so many products, but we like the transparency of this particular company. I'm sure we'll change our mind in a couple of years' time.
And you can recommend other things as well.
We always recommend other things, and I'm constantly looking at new and latest products. At the moment, this comes on our top of our list. So it's, if you look on Yuka, it's good
Yes.
for you, it's good for the environment, and it's good for you. And the exosomes we found really effective.
Yes.
And the 3 ingredients, what were the 3 ingredients that I like? Can you remember? Retinol.
SPF.
Perfect. And
Hyaluronic does come
I
up
do
there,
like,
doesn't it?
I do like a bit of hyaluronic to give me some hydration. And all of these products are available with many different companies, but we use specifically Tropics. Now, should we go through some of our questions?
Yes.
It was quite exciting.
Out or nerve-wracking.
Yeah. Give me an easy
I
one.
can give you one.
Give me an easy
Okay,
one, please.
let's put my glasses on. Hold on. So, what's the one thing you wish everyone knew about plastic surgery?
So, what is the one thing I feel everyone should know about plastic surgery? I think it's, for me, it's really simple. A lot of people underestimate the recovery period after surgery. They just think it's surgery and it's done. And they underestimate what the scars can look like in the immediate period. So if you go onto Instagram or Facebook or whatever, you see the before, and then you see 6 months after or 3 months after, and that's it. But you don't appreciate what happens in between, and that can really put people off. If it can really reduce the experience of surgery. So the scarrings can be dark, they can be ugly, they can be lumpy, they will be painful, and you can't do much in that first 6 weeks, particularly with breast. No heavy lifting, no bending over. And I think the most people find difficult is not being able to have a proper shower after having surgery.
Yeah, I think so.
You know when your hair gets all really horrible, and I'm like, you can't get into the shower because I need your dressings to be dry. And I think people underestimate that. And when they're not prepared for it and they do all these things, it messes up things. You know, when the dressings get horrible and soggy, you've got high risk of infection. When you're doing too much activity, you're pulling on the stitches. So importantly, really, really prepare for...
It's the reality of it then, actually, isn't it?
That's really important, the reality. So for me, the managing expectations of that recovery period between the before and after. And I think we should show more pictures of that.
The in-between steps.
People don't. I try and show it in...
and I think as well, if something isn't going quite to plan, but people don't ever think it will be them.
Yeah. Exactly.
And sort of taking all that on board when you're making your considerations as well. You've got a question on your side?
So one of the questions that came through is, what is your favourite procedure to perform?
It depends on my mood. I don't really have a specific favourite, but at the moment I am going through a neck lift phase. I'm feeling my neck lifts. I'm finding them really therapeutic. I really enjoy the art behind it. It's like
Zen moment.
It's my Zen moment, and I like seeing the patients afterwards, and they get such a positive. They get. It really makes them, because you're seeing your face, and you can do all sorts of things to your face, can't you? You can do all sorts of creams. People forget their neck. And then when they see how much of an impact it has on their neck.
I think a neck as well is one of the most aging things for people as well. Because equally, we
don't focus on the neck.
We don't. We never used to put any creams on our necks, whereas now we are making more of an effort. Okay.
And my other, can I just add? I have a second favourite. Sometimes it goes to first, depending on my mood. Breast reductions.
I
love
I know you love that.
You know I love my breast reduction.
I do know, but you're so good.
I love my breast reduction patients. That's the best thing. And again, it's a functional operation. They get back pain and all of these other symptoms. And when they come in after the surgery, you think they were different people.
It's just life-changing, actually. Okay, let me ask you then. So you obviously, when patients come in, they have lots of questions that they're going to ask you. Do you have a most common question patients ask that really surprises you?
A most common question that really surprises me. Yeah, the most common question is, will I have any scars?
Okay.
And yeah, so I think when people come to see a plastic surgeon, and that surprises me, they think they're coming to see a plastic surgeon and we can do surgery without any scars. And the reason why we're plastic surgeons is that we're able to do surgery without showing any form of scars. But you can't do surgery without
Do you think part of that goes back to what you said a little while ago with the where you only get a picture of before and after when all the healing is done, and of course scars go white?
Yeah.
Do you think that plays a part in that?
I think that plays a massive part in it. They just see the best of the befores and the afters, with the best of the afters, and the scars do fade. We put them in places. You will have a scar, but we put them in places that are discreet. So that's why you may think it's scarless, but nothing is ever scarless. There will always be either a small or a hidden scar somewhere.
So that takes you by surprise when you're asked. It's impossible.
It's impossible.
You're not a miracle worker.
And that's it.
Okay.
Shall we move on to
I think,
our grand?
Yes, I think you should.
Yes.
What's coming in?
So we have been approached, and we're in the process of introducing a new surgical procedure into our practice. We will be the first, if not the only, and the first people to be offering this surgical procedure, which I'm very honoured really because excited. I don't really offer it to anybody. And that surgical procedure is for those with who wanting breast enlargement, is a technique or a technique called Preserve. Okay, do you know much about Preserve?
I didn't until recently.
So conventionally or traditionally, when we do surgery, we have to put you to sleep for breast enlargement. So this is specifically for people who want breast enlargement. Now we can do this surgery while you're awake. So we do breast enlargements with this new technique while you're awake. Now, what does that mean? It means no anesthetic, so you're not going to feel groggy.
No.
It massively reduces the downtime.
Yeah.
And the actual technique, it's called Preserve because we're preserving the fibers of the breast. We're not cutting into the tissue as such, but we're working with the natural planes of the body, separating those planes to insert the implant.
Yeah.
And you will see the breasts immediately after we've inserted it. Hopefully it doesn't take too long. And then we assess you afterward, and then you go home the same day, and then we just keep a close eye on you. So that's really amazing. I'm really happy that we're able
so
to
excited.
What it means is that it's just so much easier for the patient. It's just. I mean, we've seen some patients that have had it, and the results are great. They look natural.
Yeah.
There are, as with everything, I have to approach with caution. I never go with anything head first. We've done a lot of research, haven't we, over the past, I would say, year when they've approached us because they know I do a lot of breast. And I just wanted to do all my research, do my due diligence, and actually this works out. So hopefully, for those who are interested, we will be introducing Preserve in the
next
new
year.
year.
That's so exciting. And the implants themselves don't need to be exchanged as regularly either, do they? So that's a real plus point.
And we're using, the company that does them is Motiva, and in my opinion, they're one of the top quality implants here at the moment. And they've got a guarantee, which is good.
Yeah.
I can't remember what the guarantee is, but it's definitely better than the normal guarantee.
The patient creates their own account. So there was a scanning system, wasn't there? So then that's all traceable.
Yeah, so that's good. So for those of you who have had implants in the past, one of the things I always ask you when you come and see me is, can you tell me what kind of implants you've had? Or can you show me your implant card? And 9 times out of 10, they don't know because they've forgotten it, or they've lost it, or they have no idea. With this new implant, what we can do is there is a small device that we can just put over the implant, and it will scan the breast, and it will tell me what size implants you've had, how long ago you've had it, and it gives me all the details if you've had any problems with it, if anyone else has had any problems with it. So we, for me, that's quite a good thing. But I just like the fact that we are working with the natural planes of the body. It's taking advantage of the natural layers. We're not disrupting any of the layers of the body, and we're able to do this while we're awake.
Which again, you know, the pain is controlled, isn't it? Because you're speaking to the patient as well. So they're able to let you know how they're feeling all the way through the procedure. So it's really, really exciting for us, for the clinic, for next year.
So that's our wonderful...
that's our big news.
Yeah, that's our big news. Now, should we go back to some of our questions?
Yes, let's go back to some of the questions. So, what's the most important thing? So this lady has said, what's the most important thing she could consider before having surgery? So is there something that you should really consider before you have it and have things in place with surgery?
I think it goes back, the most important... I don't think there is a single most important thing. There's probably a few important things that you need to get sorted.
Yeah.
The first one is managing expectations.
Yes.
Okay. I think people come in, we can only, first of all, you have to be fit and healthy for the surgery.
Yeah.
Yeah. So one of the managing expectations in terms of, I may not be able to do your surgery. And the reason why I can't do your surgery is because I have to be honest with you, it may not benefit you.
Yeah.
Okay, so you can be as desperate as you want. If I don't feel that surgery is going to be beneficial for you, you have to manage your expectations that actually this might not be worth it for you. And then in terms of, again, recovery period, it's really important to be aware of the time that you need to put in for your recovery period. So I think managing expectations and me being able to say, I'm sorry, this isn't working.
Yeah.
It's not going to work. I'm not going to do surgery on someone when I feel it's not going to be good for you. It's just not worth the risk.
Yeah.
And again, being aware of what happens afterwards.
Yeah.
So I'm going to, can I ask you guys some questions?
Yeah.
I'm scared.
Yeah. Okay.
So I'll ask you first. Now, out of all the surgeries all the patients that have had surgery, which one is your favourite?
In terms of which body type?
Yeah.
Not a particular.
Yeah.
Well, I think the breast reductions.
Yeah.
Because seeing the huge difference that there is. I know for patients outwardly, not everybody's going to see that part of them. But I am just so amazed when I see those.
Yeah.
So amazed.
Yeah. What about you?
I actually really like when you do the nose jobs.
Yeah.
Because the before and afters are incredible. And I know it can take up to a year, can't it, for everything to calm down. But it is really life-changing for your patients. And you can see that they're so happy, genuinely happy with it. Because it can really transform your whole face.
It really does.
So that they are my favourites. They are my favourites, yeah.
I have to add in there, actually, because as a general surgery, the breast reduction, as a local, it would be blepharoplasty.
Oh,
Yeah.
You're right. I do like a local blepharoplasty procedure. So now we're going to go back to what kind of things we offer at the clinic as well. So what other things do we offer at the clinic? So one of the things that I quite like doing, again, it's about skin maintenance and facial preparation. and that's PRP.
I love PRP.
You love PRP.
I am such an
Tell me
advocate.
why you love PRP.
I think it just completely rejuvenates your whole face.
Yeah.
You need it done twice a year minimum, isn't it? Within, is it 6 weeks of having your first one?
Yeah.
I've had it done. I really like it. I feel that my skin glows a lot more. I've had so many compliments on my skin, and it is all because of that. And it's your own product, so it's your own blood which gets spinned and then injected back into your face. So to me, it's a natural procedure.
Yeah. So PRP is platelet-rich protein.
Yes.
It's a protein that helps stimulate and boost the collagen production. And collagen is what you need for the tightening of the skin and the quality of the skin, which is what we all want more of. And there are different types of PRP. Now, there are lots of places that offer PRP. I'm not sure. It's questionable whether it is actually PRP, but the method of the way we do it, we use PRP, which is your own blood product. Like you say, we centrifuge it or spin it, and we actually inject it properly into the dermis rather than just smear it.
Yes.
It goes into the dermis. Whatever we get, we use that liquid gold, and we put it into the dermis. And there are lots of places that kind of just put it on as a serum, and I'm not sure it is as effective as injecting it properly into the dermis. So you do get
it isn't.
But you do get some swelling, don't
You do get swelling. You did get
only on that day.
Yeah.
To be
and
fair,
only actually for a few hours, isn't it?
It goes down.
Yeah.
I think I had it done just before I did the school run. So it was, but it's not horrific. I mean, if I went to the school run, that pretty much shows that it wasn't that horrific. But yeah, it's fine. After an hour, it's not as if you even had it. So
now tell me about the pain.
It's okay. I mean,
where is the most painful part?
Do you know what the most painful part? You put it in my lips. That was the most painful part, and my lips swelled up so bad. But actually, I quite liked it because when the swelling went, I was like, oh, maybe I need some filler in there now. But no, I would never do that. The lips are the most painful part, and also around the eyes. I found, but I'm quite sensitive around the eyes. But apart from that, was not painful, and I will happily do it again. So.
Did we do PRP on you
once? Yes.
Did you?
I found it. I mean, it's not ever going to be your favourite thing that you have done. Let's face it, you are having needles put into your face. However, I found it bearable. It was, and actually for the amazing results, if you were continuing, this was something you haven't, it's really worth it, isn't it?
100%. It's a bit like Botox, isn't it?
Yeah. Well, no.
I felt like it was the same.
Oh, as in the injection.
The injection.
The injection is like Botox. The effects are different. Sorry, I misunderstood you. That was me.
Yes, it feels like you're just having Botox in the whole of your face.
Yeah.
But it's better than Botox.
Yes, we're doing a lot of those in clinic now, aren't we?
Yeah.
So
yes, we are.
Yeah. I think generally facial rejuvenation is we've seen a lot more of this year, would you say?
I think
with
you're
all
right.
of them?
Really popular.
With all of our treatments, and of course we've got the LED masks.
Yeah, LED
That's
masks
an important part as well.
Home. Do you use your?
I use mine every day.
Yeah.
Every day without
fail. That's what does that do? That's penetrating deeper into the layers, isn't it?
That's a home remedy, I suppose, that will help rejuvenate the skin. So again, when we're talking about helping your skin, either planning for a facelift, or if you're not sure about a facelift, you just want to do something at home to help improve the skin. So at home, I'm going to keep on going over this. Retinol, vitamin C, SPF, you need to do that at home. And the LED face mask. So you wash your face, clean it, put the LED face mask, red light, near infrared for about 10-15 minutes.
Now it has to have the near as well, because there's loads on the market that are just red light, and it's not the same.
It's not the same, So near infrared, keep it on for 10 minutes, take it off, and then you use your retinol serum, and that's it for your evening routine. So LED, I personally think you get results probably around 3 to 4 weeks after using it. But you will get that, oh, you're looking really refreshed. And it's clinically proven. So there's been research.
Yeah.
And it shows that it works by a process called photobiomodulation. And that stimulates the power cells, the mitochondria, to produce collagen again. Collagen is the buzzword, I think. And that's really effective. So that's what you can do at home. And then if you want to come into clinic and have something a little bit more interventional, we've got PRP.
And the radio frequency.
And the radio frequency.
Yeah.
And then if you want something a little bit more, then we have to really go on to surgery, really. So that's the surgical neck lifts, or the mini facelifts, or the full facelifts.
But again, you can start off with some local anaesthetic.
Absolutely.
Small things, can't you?
Yeah.
So you're not
Tweakment.
So from what you're offering, you don't have to jump into general surgery. So it's a little ease your way in. So we do lots of lesion removals as well, don't we? And
so in terms of easing your way in, I think a really good way to see whether you will be a suitable candidate for surgery, I can assess you. You can decide whether you want to have facelift. There's doing simple, I would call it simple, but easier on the body procedures like eyelid surgery that we've already touched on. So eyelid surgery, it really rejuvenates the face.
Massively.
And you still look like yourself.
You
don't look like someone completely different. Lip lifts, again, you have to approach it very judiciously. So a careful approach. So one of the things that can happen as you age is that the distance between the base of your nose and your upper lip can get bigger, and that kind of makes you look older. But if you have that lip lift, it gives that natural rejuvenated look under local anaesthetic without too much downtime. So they're just small little things, and a lot of people with all of that, they might be fine, but some people might say, okay, I'm happy with what you've done. Let's go a little bit further.
It allows you to see how you feel about surgery before jumping into a huge general anaesthetic, doesn't it?
And some people don't need to have what they think they need, if that makes sense. So you could have something very small, and actually you might realise that, I don't need a full facelift. I'm quite happy with what little treatment you can do.
Great. Any more questions?
There are some more questions. Rachel, have you got some as well?
I have got some. So let me see. I was asked lots of questions. Okay, here's one someone asked, which I think is quite an important one. So what signs to you would indicate someone might be having a bit of a problem during recovery? Because obviously people can feel a bit nervous having things, can't they? So how would you know that there might be a little bit of a problem?
As in before the surgery? Or
during the recovery?
During the recovery.
What sort of things happens in the body?
So in terms of post-surgery, things that you need to be looking out for are the physical things like complications and risks. So one of the things that we try to catch early to prevent long-term complications or issues long-term is catching infection early. So if you've just had surgery and everything's going fine and you're on day 5, day 6, and then suddenly you see, so your pain's going down and then suddenly the pain's gone up after about day 6, day 7. If you notice redness, fever, but even before the fever, if you get a sudden increase in pain and redness, that to me indicates there is an early infection or there's an infection brewing. So I would have to see you fairly soonish to give you the antibiotics and treat you and change the dressing. And if we catch it early, it prevents the patient from getting sick. And it prevents the wound from breaking down. So infection is something that we need to catch early after surgery. So if you've had it, you're feeling fine, and then suddenly you start feeling rough in that first 2 to 3 weeks after surgery, then we know that there's some kind of infection brewing and you need to come and see someone, your doctor, your surgeon, or your GP to get some antibiotics. And that's it. Any other questions?
Yeah, someone's actually asked you, are there trends in cosmetic surgery, and are there some that you love and some that you don't love doing?
Yeah, so there are some, there's always trends coming and going. About a year ago, we had a whole flurry of people that wanted, I don't understand, but they wanted butt lifts.
Okay. Yeah. And there's quite a few people that are wanting them taken out now. I think the trends have. Yeah. That was a trend. I don't know if. I think some might still want it done, but I
personally don't do. I personally don't do it. I know lots of people that do. I personally don't. It's not a procedure that's recommended because of the high risk.
Yeah.
We know that there have been a few deaths, generally abroad, but it is quite a risky operation.
Yeah.
And I like to stay objective about surgical procedures, and I think the butt lift is difficult for me to stay objective about, particularly when I can't see my own backside. I don't understand how you want to have surgery on a part of your body that you may not be able to see. Yeah. Each to their own, but it's a trend that I don't like, and I hope it does go down very quickly.
I don't think there seems to be that many. There's quite a few celebrities that have now had them taken out.
But yeah.
Are they the same as like breast implants?
Yeah, what are they?
So there's multiple ways that we can do the butt lift.
I don't know.
So there's lots, and I've seen complications on the NHS from the various procedures. So there's many ways that you can increase your bottom region. It can be using your own tissue, or it can be using artificial silicone things. So generally it's the silicone stuff that we don't like using. So abroad you can have silicone injected in your buttock region. And the complications, so I'm going to tell you what happens, and I'm going to tell you the complications. The complications that you get from buttock injections is that the silicone travels.
Yeah,
so a few months ago, I saw a patient that had silicone injection abroad. She had it done about 2 years ago, and it was in the upper abdomen. So here, she had it in her butt.
It's
worked its way into the abdomen,
right,
and then down near the knees.
Oh,
wow!
So whatever silicone she had, it's kind of moved all over the body. It's migrated, and she's been having symptoms. And because there's so much of it, we can't remove all of it. It's too dangerous. So we have to do an MRI scan and look at the areas that are problematic and then remove those areas.
So it's travelled in the bloodstream?
No, it's just travelled in the
within
surface,
the fat, within the fascia.
Yeah. And that's one way of doing it. Another way of doing it is just you put breast implants, you put butt implants in. And again, they can travel, they can pop, they can burst, they can go into different parts of the body.
Flip. I'm sure I've seen one where it's flipped.
And all of these are, if they become problematic because there's lots of important vessels and nerves in the butt region, and that's where people get. When things get caught up inside, it can travel to the heart, and that's how people die. They can get embolisms. A natural way of doing it is fat grafting, but again, it's quite dangerous because you're injecting into areas that are very, very sensitive in terms of blood vessels, and they can travel to the rest of the body. You can have a surgical lift. I would say if you're going to have, I don't do them, so don't come to me for butt lifts. Please don't come to me for butt lifts. I do not want to do them. There are lots of good surgeons out there that do them. I would say the safest way is probably just doing a surgical lift, where you're left with a scar at the base of the back, and repositioning the fat that you've already got. Fat injection, it has to be done in very, very reputable hands. But the safest way is, I would say, just doing a lift, because you're reducing, you are able to visualize all the vessels, and, you know, fix anything that needs to be fixed and if there's a problem. So that's the trend, and that's what I would not do. It's not my thing. It's not my specialist, but it's something that the public need to be aware of.
Yeah.
I do get asked a lot about the not being able to fly.
Yeah.
So that's 6 to 8 weeks either side, isn't it? Can you explain just why that is?
Again, flying, multiple reasons. When you go, it's long haul flights. So when you go on long haul flights and you are having surgery, particularly if it's greater than 90 minutes, before and after, you are at a higher risk of developing clots in the lungs or the legs, because multiple reasons, but you're static for a long period of time, your blood isn't flowing, and then when you come and have surgery, you've got significantly high risk of clots, which is, frankly, if it goes to the lungs, is life-threatening. So you have to be very, very open about telling us when you are having your surgery, when you're going on holiday, and how far you're traveling. And it's really important, to be honest. If we have to delay your surgery because of your holiday, then we delay your surgery because of your holiday. So that's that. And then afterwards, again, same thing. You have a high risk of clot formation. That's the main risk. But also, when you've just had major surgery, you want to be close to your surgeon in those first few weeks. You know, if you have an infection on the plane, surrounded by all these people that are traveling, there's lots of bugs. You don't want to be in that environment. And if there's anything wrong, you want to be able to call us and really say, let's have a...
I need you.
Let's have a... I need to see you. Please. And then we're here and then we can see you.
Yeah, definitely. I think if I was going to do surgery, I definitely want to be able to get to my surgeon. Because if not, you're just going to the NHS, I'm assuming, which... Yeah, they're not going to help you in the way that you want.
So, anything you were coming... So, has it already been 45 minutes?
It has.
Wow.
It has. This is what happens when you're having fun. You have got more questions, but I don't know if we can save them for another time.
Another day. Anything else you want to add?
No, I mean, you've had a few people saying hi to you on here, which is really nice.
Hi,
Samantha. Gio. Oh, Samantha. Hi, Samantha. Lovely. Oh, that's nice. So, thank you so much for joining us.
We should wish everyone a Merry Christmas as well.
Christmas.
As we're nearly there.
We will hopefully do more of this regularly. And if you want us to. And also, if you have any photographs that we want some advice on, you can send them in. We can have a look at them. Or if you have any other questions.
And don't be nervous. Come into the clinic. It's just us. Just come and see us.
We are very, very...
I think that's nice because we are a really small clinic and you know us all. So it is really lovely. And where we're located is really discreet, which I think is also really nice.
There's no walking through busy waiting rooms with everyone staring at you as you go through. It's just our little team.
Great.
Yeah.
Brilliant. Well, thank you very much for joining us, and hopefully we'll see you again in the future.